and welcome to the Business of Data podcast. I'm your host, Catherine King, and it's a pleasure to have you join us today. In this series, we'll be speaking to senior data analytics leaders to share their experiences, challenges, and insights. Let's go ahead and dive straight into today's episode. Today's theme is all about data strategy, foundation, and digital transformation, specifically how COVID-19 is creating a new demand for data and how the response has been for that data integration and privacy challenges. And we couldn't think of anyone better than to bring on Besa, who is the CDO, Chief Data Officer for MercyFirst. Now, Besa has been the CDO since 2017, and MercyFirst is a not-for-profit social service agency that is working with critical services in children and families in Brooklyn, Queens, Nassau, Suffolk, and Suffolk counties since 1984. She oversees the research, evaluation, analytics, and compliance for the health division. And she also, if that wasn't enough, doubles up as the Chief Compliance Officer and Information Privacy Officer. And to add on a little bit more, she's also the adjunct professor for the New York University of Silver School Social Science as well. Wow, Besa, you are a busy bee. It's lovely to have you here today.
Pleasure to be here. Busy is an understatement, but you have to do multiple things. It's the new world that we live in, multitasking.
Absolutely, you've got to keep busy, and I think we are busier now more than ever. So many, especially your industry, being in healthcare, which I think is safe to say has been pretty impacted by the current situation we find ourselves in, which kind of goes straight into my first question really for you. I mean, it's such an interesting industry, and you've spent your life, dedicating towards it. What drew you to healthcare and doing the work you do?
I love working with people. I think that was one of my things. I started out initially as an engineer, many years ago, and realized quickly that some of my social science, my health courses were much more interesting. I kind of gravitated towards that. And I did sort of like a loop in my career, starting off with more of the hard sciences and kind of moving into the soft sciences, the health sector, and then coming back to data. I realized that this sector really needed those skills. And sometimes the individuals, either like physicians or clinicians, do not have those skills, but they're critical in the healthcare sector, very much so. And the more that we're moving into this post-COVID world, that, having that integration in health, as well as having the tools to be able to do our work remotely, online, and working very differently than what a lot of our physicians have been trained, or the way I was trained. I'm also a mental health practitioner. So, initially when we started with telehealth many years ago, was a foreign thing. How can you do remote sessions with a patient or a client? And now it's common practice that some of those barriers are breaking down. I think I'm all for it. There's a lot to be gained in this process as well.
Wow, that's fantastic. I always talk about the different hats that people wear in their life, and boy, do you have a closet full of different hats. And
plenty of hats, all sorts of colors.
Yeah, all sorts of colors and sizes.
Sometimes I get them confused in different settings.
I want to pick up straight on that point of you saying, having experience working in a new way. How have you found? Obviously, I'm assuming you are working from home at the moment. How have you found that transition into everyone being at home?
I love it. Technically, I'm in my office. As you can see, it's a very nice neutral background. I didn't need any waterfalls or anything in the background. So having all of our staff, as far as clinicians and others working from home, it was foreign for our organization. Most of the mandates for healthcare require face-to-face interaction. So moving into online digital platforms was definitely something new. But to the testament of all of our clinicians, our physicians, and others, they're champions. They're able to move, do things online and remote very differently than they did before. Obviously, with a lot of hurdles in the beginning, our technology not working the way it should, or just getting comfortable. I think the technology was working, but just getting comfortable with new platforms, new settings. And, like with change, it comes incrementally or in a cataclysmic way, and sometimes you have to sink or swim. So kudos to a lot of our clinicians that they're, and physicians, they're able to do things very differently. Obviously we do are required to provide direct services for young kids, where we have to see them for clinical and medical services. That's not going to change. But doing things that, for well care or other components where some of those can be done remotely has been, definitely an interesting new way of doing things. And I see a lot of benefits to that as well. That it could actually reduce the amount of time that our patients are traveling, number one.
Yeah.
That actually reduces barriers as far as access to services very differently. Another thing that we've done is that we enable technology for a lot of our children and families, and that's thanks to a lot of different organizations providing services during this time to the healthcare and social service sector, that we're able to enable and provide tablets or cell phones. And therefore, when they didn't have, our children and family didn't have access, now they do have access. It's just the learning curve, I think, is there, that I think the younger generation is picking up pretty quickly. Some of us are taking a little bit longer to get there, but we're slowly, incrementally getting there.
That's so interesting. So when we talk about digital transformation and COVID, now were you kind of towards that digital, were you on that journey of digital transformation and COVID just super soared you into being a digital enterprise, or were you really not in the beginning and suddenly you got thrown into this journey that you weren't on the tracks for?
So that's a good story. Initially, when I came to MercyFirst, before this, I was in Afghanistan working on a project, a USAID project. And it was interesting because I was in New York and doing things through Zoom and different types of application and managing a team in Afghanistan locally. And I realized that, for us, maybe it's a foreign concept for a lot of European organizations or American organizations that are kind of locked and bound for location. But internationally, a lot of the projects, we're using a lot of these remote options.
Right.
Is that we weren't leveraging them the same way. So they gave me a really good impetus when I left that position and I decided to take this position. That my first thing when I walked in, I realized that the organization needed a digital transformation immediately. And my initial position was primarily research, evaluation, analytics. But in order to do that, I needed the right data, the right information. I realized the infrastructure wasn't set up for me to do my job the way I needed to. So the first thing that I did is I created a long digital transformation journey. I have it since, from 3 years ago. And I'm like, refer to that PowerPoint that I did 3 years ago. But I think what COVID did, we were in a path of that digital transformation. But what COVID did in 3 months, it took me 3 years.
Yeah.
So it actually accelerated and pushed things to the fore that I would have never done. It would have taken me another 3 years to get there. So in a way, I'm thankful. I'm thankful for the aspect of, having an opportunity to move projects forward and move things, work differently, or even explore the option of working remotely or working, from home. That it's not a deal breaker. It's actually very productive to provide our staff as well as our families the opportunity to blend work and life very differently than, in prescripted 9 to 5. We no longer live in a 9 to 5 world. We live in a 365 world, but we're stuck in these antiquated notions that we have to do things from 9 to 5.
Yeah.
The world doesn't work like that any longer. So I'm thankful for that aspect. I think, I saw this post from Microsoft where they're like, their CEO basically mentioned that it took them in 2 months, they were able to fast track a lot of these projects that they couldn't have done in many, many decades. So it's a similar story from our end as well.
So with that transformation happening from 3 months to 3 years, now what were the key things that were the barriers for that happening just normally? Was it a case of that people's priorities weren't there, or I've heard in previous conversations there's kind of that culture as well. I mean, Crillian's a remote working company, so I've heard it so many times of like, you just sit on the sofa watching Netflix all day and do a bit of work here and there. It's not the case at all. So do you think that what COVID has done is, got rid of all of those hesitations because there's no choice anymore, and that has enabled you to run? Yeah.
Exactly. I think the whole option of pandemic and no choice, It's definitely, we've never experienced this before. It's definitely a very different world not having that choice.
Yeah.
But one was the culture, I think, sort of this fear. What does it mean that if somebody works from home, how do we ensure we're able to manage, the workload? How do we ensure that there's patient safety and well-being? Each of those components, I think, were very foreign. And then we realized pretty quickly that not only are people working more, they're actually nonstop working, and they're working remotely because they're on their phone, they're on their tablet, they're on their laptop. And actually we see the counter where people want to come back to work because they had a 9 to 5 sort of allotted time, and working, in a very sort of fluid way means that you have to set your schedule very differently, and you have to interact with your colleagues very differently. But you are correct that in a way, it was the culture. I think the culture had to change dramatically. It was cataclysmic, that we had no choice but to think of alternate options. On the positive side is that I remember when I came in, a year later, I had introduced the organization to Teams. When I came in, I had to travel to Long Island, and from my home, it took about 2 hours to get there. And driving there, I'm like 2 hours driving and 2 hours driving back. That's 4 hours of lost productivity. So I did a cost benefit analysis where I saw the amount of travel and how much productivity gets lost that way. I'm like, is there another option to work remotely? I could just remotely, have a conversation. That way I save 4 hours, of other time that I could be, devoting to something else. But it took, I think, this pandemic to sort of shift things, and where organizations or even funding organizations didn't have a choice, but to sort of pivot pretty quickly because they had to. And I think that kind of like pushed things very forward. And it's actually changing the organizational culture very differently, from this fear regarding, what does technology mean as far as work-life balance? How do we incorporate it? And I keep telling, our staff, as well as my colleagues, I'm like, it's just a tool like any other tool. Like a typewriter was a tool, or a calculator was a tool. This is a tool. Is that how you structure it? I think that's the key.
Absolutely. I couldn't agree more. Now, those voices that I'm sure you would have heard when you first brought in that PowerPoint, when you took office as CDO. Now, were there some hesitation? Because I know when a CDO goes straight into office, and if you want to change things, because you look around and think this needs some digital transformation, were you met with resistance, or were you met with, let's get to it and run with you? What were you met with?
More resistance than gung-ho, let's change all our systems. So I think what I had to do initially when I created the PowerPoint, it was sort of eyes glazed over. They're like, this is great. What does all of this mean? Besa's talking a completely other language. It's definitely not English. So I had to, I realized after I did that PowerPoint that maybe it was too much too fast in a lot of ways. I didn't have COVID to pivot. So what I had to do is sort of, take a step back and think about as far as organizational change and change management, rather than just going in there gung-ho, guns blazing, like here is my 13-point, project. Actually, I did check off all 13 points. Everything in my checklist got implemented. I just had to create allies within the organization. I think that was key, as far finding the right individuals who are more pro sort of changing systems. And I was very happy that our medical director, as well as our behavioral health director, had worked in my position, worked with data, worked with numbers. So I had allies already built into that process that, without having organizational support, I think it's really different to make organizational change. You definitely need colleagues, you definitely need allies to push things forward. So those were the key, I think, in moving our projects forward.
And how have those voices changed since the pandemic? Because now you're kind of the other side, and you're in the process of it.
A lot.
Yeah, and I guess that is.
I told you so.
I guess that is, and I love that idea of allies. It's something that comes up whenever we talk about. On a previous episode, we were talking about data governance, and actually you need to have allies to make sure that people are really appreciating how important that is, and kind of the need to talk the right talk to the right people. So if you start talking in a language that doesn't make sense to that particular person, they're not going to buy into your story. But actually, showing that digital transformation is going to make an impact on this particular area that makes sense to them is really, really kind of crucial. Now, I'm keen to know, how has COVID impacted your data strategy? So kind of moving away from the digital transformation into the data strategy. Has it changed it? Have you had to pivot?
We did have to pivot, actually, thinking about one of our challenges in healthcare sector is sort of reporting out to our funders and others. And our reporting structures have been very antiquated because most healthcare organizations, I mean, healthcare is a huge industry. It's up at least 1/3 of, all the data structures.
Mm-hmm.
It's actually becoming bigger than finance in a lot of ways, as far as what information gets collected, built in different electronic systems. The issue is that systems do not talk to each other. So it's a very antiquated way of, I have this really amazing electronic health record, but I am going to download this information and give it to you in an Excel sheet, which doesn't make sense. For them to upload it, I'm like, why can we build pipelines from different types of systems where they could talk to each other? The whole process, what's called interoperability. That has been a huge challenge in the healthcare sector. I want to be able to have my healthcare data follow me. If I go to a different hospital, and it doesn't have to be local, it could be global, that I want others to be able to access that information, provide the most adequate care. So if I'm a diabetic and I'm traveling, I want to be able to travel from here, go to Paris, and that physician is able to pick up and continue and see everything that they need to see. But currently we don't have that type of system. So individuals that have certain types of conditions have to have immunization information or other types of critical information with them when they're traveling, or even going from one hospital to the other. Down the street, you could see the hospital, but you have to carry your records, or the records have to be manually, sent either in disks or secure messaging. Some of them have that aspect instead of sharing that directly. I think that's a huge barrier to healthcare, and it's a huge barrier to health, especially now. It's becoming very apparent in COVID world.
Absolutely. I
think.
Oh, go on.
It's highlighting all of those gaps, putting a spotlight on them.
Absolutely. I think when we're talking, I was recently running a customer experience event, and not only are you now talking about processes that just are outdated and analog, but now you have that very real and very public kind of view that if you get this wrong, it can look so bad, and not having the availability to the data is not only going to impact that person but your brand as well. And obviously as a business you need to be reflecting well, and in healthcare that is just absolutely crucial, that you are seen to be doing the best you can by your patients and by your medical staff. So, and that kind of wider impact that those silos are now having is very front and center. And I think, well, you tell me, has that had an impact on kind of getting people bought into, this concept of interoperability and, and moving that forwards?
Absolutely. I think it's highlighting. I was just reading an article yesterday where, so for us, a lot of our contracts are through the Department of Health, and then we have to report what are called meaningful use outcome with value-based care. So we wanted to ensure that we're providing the best care for the value for what's being paid. But even reporting out, what the article was showing, that they're using fax or phone to report data, regarding patient data to funders and others. And that was just mind-boggling, that each of us as an organization have these amazing systems, but they're in silos. And I think the important thing, especially with healthcare and with COVID, that we're all interrelated. So our systems have to be interrelated very differently. And we can't think of, I am the best hospital and I have the best system, and not to think about your, neighbor's hospital, that they don't have the next best system, because your patients are going to go from hospital to hospital, service to service. So each of us have to work together to ensure that all of our systems are working the way they should, because we live in a very transient world. And even post-COVID, I know we're locked in for a short period of time, but once a vaccine gets developed, and we'll see that patients are going to require that most of this information follows them very differently. So then hospitals and other systems have to react to that, consumer demand very differently. And even, you see that a lot of hospitals have like My Point login, where the patient or the client can log in and see their information. just become much more aware as far as what services am I purchasing. You're purchasing healthcare services, just like you're purchasing a coat. You would examine when you're purchasing a coat, but you don't get to do the same way if you're purchasing different types of services. And I think that it's
Absolutely.
going to change even more based on COVID, that we'll have to think about how do we work together, putting in different types of bidirectional data exchanges, allowing that information flow and allowing the patient to have the right choice as far as first shopping around, but also having a good full understanding what does it mean and to be part of their healthcare. And I want to ensure that if I'm getting healthcare, that is the right care for me. And I'm paying for the right things. I'm not overpaying for a Hermes bag when I only want, something from, I don't know, Lord and Taylor, or even something cheaper than that. Whatever it is, that I want to have that option.
Absolutely. And I, kind of in that same breath, when things are operating in silos, you just don't have that visibility over quality and, kind of
transparency.
Yeah, absolutely. And I was chatting to another CDO from another company within the healthcare industry, and he was saying that he was really struggling with getting to grips with where data was coming from, because everyone's so data hungry right now and data's coming in from everywhere. And suddenly he discovered one of his teams was using this just random piece of data set that they didn't know where it come from. And they were like, this isn't from kind of the go-to source. Where has it come from, and why is it being used? And it's impacting decisions that are later down the line. And I suppose those silos are only, creating a foundation where this can occur, because you don't have that transparency across them all.
Absolutely. I think one of the issues, it's really timely, because one of the things that I would like to do, that there's plenty of data. The problem is that it's coming from all over the place, and some of it is important that you need to pay attention to, and there's a lot of information that's not important that should be ignored. So trying to figure out, you have so much data, we're swimming in information, is that what are the key indicator or the most valuable information? You could measure anything, I tell my students, but you want to measure the right things to get to the right outcome. That some of that is background noise. Unless you want to focus on that noise, then that's fine. But I think it's important to figure out, and that's exactly it. Sort of figuring out, have a data discovery, trying to figure out what are all the data sources that are coming in. And each time I'm in a meeting, I figure out a new data source. I'm like, what? This is from CDC. We have access to this. And I had no idea. We have access to this. What do you mean we have access to this? And I'm like, you're making immunization decision. And what about this other system, which has the same type of information? It's in 4 different systems. Child immunizations for us is in 4 different systems, city, state, federal, and otherwise, and in 2 different electronic health records. So we don't have a complete picture because it's fragmented in 4 different systems. That's a challenge. And each time I'm in a meeting, I'm finding there's new information somewhere else that we should be aware of. I think for organizations and other CDOs, is understanding the lay of the land is important. Understanding what information is coming in and what information is going out. I think both of that is really, really key. And then the second component is understanding that you have all this information, trying to figure out what is the most critical information and focus on that to actually inform decision making, because that's the most important thing that you're going to be using data for.
Absolutely. And when we're talking about these kind of key learnings, for you, if you can take a pause and a moment to just look back over the last couple months and few weeks, what would you say has been the biggest learning experience for you, where you've been able to sit back and think, wow, that's really interesting, and something that COVID's kind of brought to light for you, that perhaps was just kind of going along and it wasn't really noticed, but suddenly has become forefront for you?
So I've become a very popular person.
Yeah.
My background, I also have a background in public health as well. So it's interesting, when I came in, I'm like, we have to do things more remotely or have a balance between, leveraging technology differently. Even for some of our foster care programs, where the kids are used to cell phones and text messages, but we would require them to come in with, for a 15-minute session just so we could see them, where they could answer the questions very differently. So some of those antiquated approaches are being re-examined, which I'm really thankful for, that we could do things very differently and sort of blend technology into individual as well as patient lives and allow them the choice to come in. And sometimes when there's risk, yes, you will have to do an in-person visit, or you would ask them to come for an assessment. But many other times we could leverage technology to do exactly that. And there's different types of options. There's biosensors, there's, teleconferencing, there's many different ways of getting data now. But the point is that if we do get this data, it has to be coupled with a plan to be able to use this information in a way that actually helps that decision making, and feed it back to our clinicians and physicians so they're able to take this information and make it into usable action.
So with these increased measures of technology, and I'm thinking obviously what you're doing is very, very crucial in kind of the well-being of very vulnerable people. Would you say that the policies and the kind of safety precautions of that very sensitive data has moved as quickly? Is it something that you're kind of working with to make sure that the safety measures behind it are going just as quick, so that, nothing is left behind and left open?
Because I'm also the chief compliance officer, I need to ensure PHI. So we haven't really, the federal government did relax some of the federal guidelines for patient protection during a pandemic, because information has to be shared between different systems related to health. And I think some of those can be codified down the line. I guess there has to be a balance between patient safety as well as safety of society and communities. Absolutely. So you would have to find that balance of, yes, you want to protect that health information, but protect it at what cost? Because you want to ensure that this information gets relayed to city, state, and federal systems in a timely manner, number one, but also in order to be put into action to protect a larger community from getting infected. So I think for us, is sort of finding that balance of what information can be shared. I think right now I'm working on a questionnaire where certain, questions are too sensitive. And sometimes understanding that we're going to be living in a world that we will have a lot of those sensitive questions, and try to figure out a balance between organizational needs, individual privacy, and community and larger society needs, and balance those. So it's not as fast. I think it's been a challenge kind of going back and forth, ensuring privacy, not falling on that part, but also being, responsive to the needs of the organization as well as community with, timely information.
I suppose going back to the original point of you wearing so many hats, by you having that role in compliance as well as the data role, you can kind of combine your thoughts on both and make sure that you're running in a very linear path. Because I could imagine if someone else, came along and had that role, or was in a different department, you could end up going down different routes, which would make the whole journey far, far more challenging. So that's really...
When I came in, initially I came in as a chief data officer, and then I remember the HR director running behind me. Oh, by the way, you're also the chief compliance officer. I'm like, what?
Drop that into the conversation.
I'm like, did I agree to two roles in that process? And then it became very apparent that, oh, by the way, this is on your lap as well as the data and the governance and everything else in between. So
do you find they do work melodically together, or do you find that you sometimes kind of fight yourself depending on which role you're in?
So I do fight myself. Sometimes I feel like a Gemini going back and forth. I'm like, no, having those arguments, the critical arguments that I definitely want the data, but also understand the protections. You're right. If it was two different people, we'll definitely diverge in a lot of places and converge in other places. But because I'm one person, that I have to make the best out of two different positions. So I guess my thinking would be different. It's a blessing in a way that I have that aspect of compliance and ensuring protection, security of information. But on the other side, I want to be able to use this data for decision making and put in different projects that actually push things faster. So because of my dual role or my multiple hats, I've kind of been not as fast in that transformation journey, just because, as you mentioned, that there's this dual or counterbalance of argument in my head, should I or shouldn't I? Should I or shouldn't I? And pick the best of the both worlds sometimes.
Although you say you're kind of behind, I'd imagine you're actually further in front though, because rather than, creating a strategy and running projects and then being stopped in the process because you haven't considered A, B, or C, actually because you're considering them the whole time, you can kind of keep going because you're counterbalancing the
so my train is slower. than other people's trains. I guess you're right in a way. It's not like a bullet train, or it's one of those slow trains that it's going along the path. You're correct that in a way I don't have somebody that I would just, blaze through and then you have like a full stop. So my train is a little bit slower getting there. I guess that's a good analogy, but it's getting there very differently than, if I was just have the CDO hat all alone.
Yeah. So thinking forwards then, what is top of your to-do list over the next, I would say next few months, but I think it's fair to say we're not quite sure what that looks like. So at the moment, where is your to-do list for kind of your upcoming projects?
My ever-expanding to-do list is, as our executive says, like, how many to-do lists? I think we took a pause during COVID. So some of that has to, I'm taking sort of some time to self-reflect, to think about, what projects can be sunset and what projects should be, more resources can be put into them. So one of the things that I do see sort of the data integration aspect, sometimes we don't have access to city-state systems. So we would have to use different types of workarounds like robotic process automation.
Yeah.
So in my mind, I'm thinking, what is the best way to do things? And the best way is to automate as many things as we can. And then another project that we kind of started and stopped were some are machine learning, natural language processing applications that haven't moved us as quickly. But thinking through some of the newer technologies, how can we leverage those very differently than what we have leveraged? And then going through the bread and butter of having conversations with colleagues as far as interoperability and thinking about how can we work together to share information for patient health and safety. That's going to be a longer journey. I think that's been like a 20, 30, 40-year journey. That's not going to change. But internally for me, it's leveraging some of the latest technologies, getting some of those quick wins for different projects.
Brilliant. And this is really surprising how much of a positive conversation this has been. When I was looking to have this conversation with you, Besa, I must admit I was thinking healthcare, COVID, this could be very almost depressing because it's such a crazy situation we find ourselves in. But what I've really drawn out from this conversation is actually you've been given a time to really springboard your projects forward. You've been able to almost do it in a petri dish because you've got rid of all the issues of people resisting for reasons of doubt and gut feeling and all of those fun things, and actually the transformation has been successful in many ways, and that there's things you're going to be carrying forward post COVID, whether that's the ways of working in the sense of it being remote for some people, and also kind of those processes like you were saying with the young people, you could have had do those questions in another way and not actually have them come in and see you. And I think it's going to be a very positive and efficient journey forward. So thank you so much for joining us. I've really enjoyed speaking with you.
It's been a pleasure, and thank you for having me.
Thanks. I look forward to next time.
Absolutely.
There we have it, Chief Data Officer and wearer of many hats. I really felt that conversation could have gone on for hours. Now, I have pages and pages of takeaways from that conversation, but really what stood out to me was when Besa said what COVID did in 3 months took her 3 years. And I really think that highlights the situation we're in right now. Whether we're talking about remote working, digital transformation, or data strategy, the transformation everyone has been on in this current time has been massive. And I do think it's going to be worth our while in a couple months' time to take a pause and have a look at this transformation journey to see what people have achieved in that time. As always, make sure you are subscribed to the Business of Data platform to keep up with all of our thought-leading content, and do be sure to be following us on socials as well, so you're able to join in conversations with other thought leaders like yourself. Until next time, look after yourself, stay well, and I'll see you real soon.